When it comes to vaginal infection and STIs, unfortunately, some people keep on treating infection, but it's not going. Hello everyone, thank you so much for joining. Please let us discuss what you can do if you have a recurrent vaginal infection. I hope you're going to enjoy this discussion together so that you all learn what you can do should in case you're treating a vaginal infection and it stays the same. So let us go. So preventing recurrent vaginal infection. Unfortunately, this is more common to hear ladies, and some men say that they have treated genital infections several times, but this infection keeps coming back. Now, the question is why, and how can you stop this from happening? We are going to discuss here under three major categories. One, preventing STI. B, treating yourself from STI. And C, vaginal hygiene / personal hygiene. So how do you prevent STIs? STIs, which are sexually transmittable infections, is an infection that spreads through sexual contacts. This includes skin-to-skin contacts. In general, STIs are preventable, but you need to take note that the only guaranteed method to prevent STIs is to abstain from all sexual contacts. However, when engaging in sexual activities, there are steps you can use to limit the risk of you getting an STIs. A, protecting before sexual intercourse. Effective STI prevention begins before any sexual activity. Here are some of the steps that you can take. One, you have to talk honestly with your potential partner about both of your sexual history. You get tested along with your partner before having sex. Avoid sexual contact when under the influence of alcohol because you do not know what could be going. The next, you get vaccinated against infections that can be vaccinated against, such as the HPV, that's the human papillomavirus, hepatitis B as well. Also consider taking your prophylaxis that can help you prevent against something like HIV. Use barrier method every time you engage in sexual activities. Having a conversation about sexual health with your partner is key, but not everyone with an STI knows they have one. That's why it is important for you to get tested immediately. Please, for those who are within Cameroon, you can use our contacts here. Get to us on WhatsApp so that we can get tested at affordable rates. The next point is that if you or your partner have an STI diagnosed, talk about it. That way you can both make informed decisions. B, sexual health practices. Using barrier methods can lower your risk of contracting STI. These methods can include using external or internal condoms for penetrative intercourse, including with sex toys. Using condoms or dental dams for oral sex. Using gloves for manual stimulation or penetration. Maintaining good hygiene before and after sexual contact can also help prevent STI transmission. This can include, please, ladies, take note about this. Wash your hands before any sexual contact. Rinse after sexual contact. Urinating after sex will also help you prevent UTI. Using condoms correctly. When using condoms and other barrier methods, it's important to follow instructions. Using condoms correctly makes them more effective. Follow these safety precautions when using condoms. 1, check the expiration date. Unfortunately, I know most people are thinking, oh, I've not been doing that. The next step is make sure the package has an air bubble, which shows it hasn't been punctured. The next is put the condom on correctly. For external condoms, always leave room at the tip and unroll the condom onto the penis. Hold onto the condom after sex so it doesn't slip. Dispose of your condom properly. Never remove a condom and try to pull it back. Never reuse a condom as well. Potential risks. Condoms and other barriers are very good at preventing the exchange of body fluids that contain the virus or bacteria. They can also help to minimize skin-to-skin contacts, though they don't completely remove this risk. We have some STIs that even with condoms on, you can have a skin-to-skin infection such as syphilis, herpes, and HPV, which is the human papillomavirus. If you have herpes, you may want to talk to your doctor about suppressive therapy. This type of therapy helps to prevent herpes outbreaks. It also helps to prevent transmission, but it doesn't cure the infection. It's important to know that herpes can be transmitted even when there isn't active outbreak. Point of interest, though STIs are common, there are ways to prevent them and reduce our risk. If you are unsure about the risk, the right method for you is that you talk honestly with your partner or your doctor. The next thing is you need to treat yourself in order to prevent recurrent STI. Treat yourself. How do you treat yourself? When it comes to you treating yourself, take note of 1. Take your drugs as prescribed by your doctor and never stop taking your drugs even if the signs and symptoms of that particular infection has stopped. Unfortunately, some people throw their drugs away. This is really uncalled for. Some of us are doctors to ourselves, such that even when your doctor sees you, gave you treatment, you still go along. Maybe you throw the doctor's treatment and start taking your own. The next thing is, during treatment of an STI, it is advisable not to have sex with people you're unsure about their status. Please stick to one partner. The next is antibiotic misuse. Some of us have misused antibiotics in such a way that nothing works for us. That is, we have deliberately gone for antibiotics when we have only symptoms without any consultation or laboratory tests. On the other hand, some ladies take antibiotics immediately after the administration that they are doing cleansing. Please, this is wrong and should be avoided. C, vaginal hygiene and personal hygiene. Point 1, wipe from front to back after going to the bathroom. I hope most people know about this. The next point, clean up mineral oils after stubborn bowel movement. Make sure that you clean up very well. The next point is try baking soda to reduce odor and discharge, but do this only with your doctor's advice. The next point under vaginal and personal hygiene is that you wear cotton underwear to prevent irritation and reduce moisture. The next point is make sure that you launder new underwear before you wear it. The next point is iron your underwear before you put them on, because unfortunately, most of our underwear will dry them in a damp area. If you do that, this is risky. Please, I hope this helped you some way. If you did enjoy, make sure you share to someone. Also, make sure that you can subscribe to our YouTube channel. Check Women's Health Forum on YouTube now and subscribe. You can also follow us on TikTok and Facebook. We are Women's Health Forum. May God bless you. Thank you so much. I'm your host, Tima Dauda for Women's Health.